we'll be sharing general COVID-19 updates. So to the right is Dr. Ali Khan, medical epidemiologist. In the middle, you have CEO Esther Muña. And then to the left, you have Rodylyn Bacani, CHCC's pharmacy manager. After CEO speaks, she'll hand it off to the pharmacy manager, and then maybe Dr. Ali Khan, if he has comments. CEO, please take it away.
Okay, sure. So we wanted to provide the update for this past weekend and what we've been receiving or we're seeing here in the CNMI. We have 2,893 cases as of December 25. An updated report will be sent out tonight. We are currently at 93.44% of our eligible population being fully vaccinated, but this still leaves a lot of unvaccinated folks susceptible to this disease. This morning, we've had our 12 COVID-19 related deaths since March 2020. We want to offer the families our sincerest condolences and sympathy. The COVID-19 pandemic has brought tremendous grief to the families, and we want to be able to speak to you about, again, the prevention, as well as some therapeutic, basically therapeutic care that treatment we have that's available and will be soon available for the CNMI. There's, I want to emphasize again, the vaccination of booster vaccinations. I want to thank the CNMI community for their overwhelming response to this COVID-19 pandemic and getting themselves vaccinated, getting their family members vaccinated. And this is really tremendous. The number of 93.4% of fully vaccinated of eligibles is really amazing. And it really does help our community and helps our health system, especially in the response of this COVID-19 here in the CNMI. So I know that it's very difficult, and for some of you that took, had a hard time deciding on getting vaccinated, I am pleading with you to please look at if you're qualified to get your booster shots as well. There is a lot of information going on, especially what's happening in the US about how the Omicron variant is transmitting within the community, and having the boosters is really important and significant to prevent hospitalizations, to prevent death, to prevent severe illnesses, and even just having to be symptomatic, even with COVID, if you're positive. So we really urge and encourage everyone to please, if you're eligible to get your booster shots, please get it. I cannot emphasize enough how important it is, especially as this community, again, continues to suffer with deaths, as well as with increased hospitalizations. And of course, with our healthcare system, with our healthcare providers working night and day just to make sure that individuals have the treatment and trying as much as possible to help them recover from this pandemic. Thank you. Now I would like to ask our pharmacy manager to speak about the therapeutics that are available or will soon be available for the CNMI. These are even therapeutics that have been given the emergency use authorization by FDA. So this is Ms. Rodylyn Bacani.
Thank you, CEO. So currently in the pharmacy, we are responsible for ordering, procuring, and maintaining the MABs or the COVID therapeutics that we have in CNMI. So first of all that we have is the region cough or the casirivimab and ETE. We have about 400 vials available right now, and we have received about 1,000 vials since August of 2021 and administered about 561 to eligible patients who have COVID. And the next map that we have is the BAM-ETI, which has gained EUA approval from CDC at last week. And we have about 104 course units that is composed of BAM and ETI. And the third one that is available for post-exposure to COVID is the sotrovimab, which we just received today. We have about 72 vials available. And the other two COVID treatments, therapeutics that we have are remdesivir, which is an IV form of antiviral. We have about 100 vials, and we have already given about 240 vials since we started using it. And another mAb that we use for hospitalized patients in order for them to not progress to death or severe progression to COVID is the tocilizumab, which we have about 4,000 milligram in the hospital. Another three COVID therapeutics that we are anticipating to get, it's being processed not right now, and it's getting ready to be shipped, are the Evusheld, which is approved for pre-exposure prophylaxis for COVID for 12 years old and up, and at least 40 kilograms. And it's a 2 IM injections. And we are working on the policy. CEO as she has approved that it can be given to unvaccinated individuals. And we are looking into our hemodialysis patients and even oncology patients because they are immunocompromised. And we are anticipating to get that within this week. And the two oral antiviral, the first oral antivirals that were given EUA are molnupiravir and Paxlovid. Those two are also being processed for shipping. So those are the COVID, and we are really fortunate that we have all these medications. We just have to really, look for the eligible patients that would really need it.
There is I want and everyone to also know that the vaccination is still the best option.
Yes, I agree with that.
Yes, and again, these therapeutics that are arriving soon, they can be, that has to be discussed with your medical provider, and especially if you are with comorbidities or basically with any health issues, that can discuss with your medical provider. And once these medications are available, we will be able to administer them to the individuals that have been identified by the provider. So we're working again with the dialysis patients, with oncology, especially those that have, for some reason. And again, this is one of the things that I've hesitated is to label individuals as vaccinated or unvaccinated, but for some reason they choose to be unvaccinated. Then that's one of these things, these treatments that is available for them. I will let Dr. Bacani, if that's okay. You want to add something?
Sure. Thank you, CEO Muña. I've been here approximately, I'm a medical epidemiologist consulting with the World Health Organization. I've been here approximately a week, grateful for the invitation by the CEO to come and assist and provide support. And I must say, what I've seen is a model public health response focused on science, the community working together, and there's great evidence of that, not just in the vaccination numbers, but as I've roamed the streets and see all these stores and indoor places, everybody wearing masks. So it's really been an excellent response so far. However, as the CEO said, at the end of this pandemic, and not the end of COVID, COVID isn't going to go anywhere, but the end of the pandemic, where it's disrupting your lives and it's, putting too many people into the hospital and keeping the economy from thriving, is vaccinations. And there's still approximately 10% of people who are eligible to be vaccinated in this community. I would encourage them to please go ahead and get vaccinated. The vaccine's safe, effective, and it's free. And now we've had over 8 billion doses given worldwide, so we have lots of data on the safety of the vaccine. And for those of you who have already been vaccinated, congratulations. About 30% of people have been boosted, so there's an opportunity for those who've not yet been boosted to please go get boosted. That will decrease your risk of severe disease from Omicron variant, which we don't have in this community. It's all Delta so far, but it's important to take that extra precaution. And what we have seen is that about 3/4 of all of your admissions are for people who are unvaccinated. So there's a message again for those who are unvaccinated to please go and get vaccinated.
Thank you.
All right, media partners, if you have any questions, please feel free to raise your hand and I'll go ahead and call on you. Yes, Tomas.
Hi, I just wanted to get more information on the recent deaths. What are some of the demographics that you're able to provide?
Right now, the concern that we have again is that, we have maybe 1 death a day, maybe 2 deaths a day. We like to protect the family's privacy and especially their privacy, and giving more details in this small island where people will know who it is, and people, again, to label unvaccinated, vaccinated, that is something that to us does not really serve any purpose of providing. We are emphasizing again that there is hospitalization. We can look at the hospitalizations, and as Dr. Khan mentioned, 3/4 of the hospitalizations are unvaccinated. They're getting into more details on the deaths is too small a number of a denominator to say that, oh yes, this individual has died of this. So we would like to keep that as information that we would like to refrain from sharing.
And I guess just to follow up, if it's okay, are they? I know the last report you said most of them were over 50. Is that what we're seeing also here? It's an older population.
We still see individuals that are in 40s and in their 20s. In fact, there's been right now there's 2 that are 2 are on ventilator. I don't know the age of the 2 that are on ventilator. I will find. I guess Gil can probably share that information.
All right, and just 2 more questions. We just like the rest of the country. Is CHCC also bracing itself for another spike in continuation of this first surge given the holiday gatherings?
Maybe Dr. Khan, maybe you can comment on that.
Yes, glad to. Thank you, CEO. Yes, so under the direction of the CEO and the task force, there's been an expansion of testing that you're aware of at the DFEM sites, increased testing internally using PCR base. So we are getting ready for an increased surge. There's also examination of all excess beds available here at the hospital and the alternate care society. However, the hope is that as increasing number of people get vaccinated, we will be able to temper any surge from a new variant.
And lastly, CEO, can you just comment? Schools are expected to reopen next week. What does preparing for a return to in-person learning for about 9,000 to 10,000 students look like?
Dr. Khan will be presenting to the school PSS maybe later on. Maybe that's something that we can cover then.
Okay, and Dr. Khan, can you just clarify when you arrived on island and under what role and I guess entity you're in?
I arrived a week ago, and under the World Health Organization has an invite to the World Health Organization to provide a consultant.
Yes, I want to thank, want to offer again thanks to everyone, from the HHS, which is basically under the HHS, we have the ASPR and CDC, of course, the World Health Organization, Western Pacific Regional Office, Dr. Takeshi Kasai, always willing to help the CNMI, and also, of course, our partners in PIHOA and ASTO. Those are basically entities and partners that we work with, and always reaching out to us, to the CNMI, the help